Good afternoon, everyone. Welcome to our Parent University webinar series. I am Charmaine Carter, the Director of Parent Relations here at Friendship Public Charter School, and I am happy to have you here. If you're just joining us, please share. We'll be talking about accessing mental health resources. As you're probably aware, we are starting to have hybrid learning on March 29th for our scholars. So we're about to welcome back our families. And this is a very timely webinar because we're going to be talking about the resources that we have in the building. And even if you're doing virtual learning, if you're going to continue virtual learning at Friendship, we have some information to share with you that you may not know. So be sure to take notes. Be sure to get ready to screenshot the information that we're going to share. And if you have any questions at all, please contact us on our hotline at 202-281-1777, or you can email our hotline at wecare@friendshipschools.org. Okay, we're not going to keep you long. Let's go ahead and get started. Mr. V and Ms. Davis, go ahead and take it away.
All right. Good afternoon, fantastic Friendship family. My name is Mr. V. I work for Friendship Blow Pierce, and I'm thrilled to be joining you all again for a conversation on accessing mental health resources. And today I am joined by
Ms. Davis.
All right. So before we get rolling, I'm just going to give you all a little bit of a background on us. My name is Jim Volsky, but I'm better known at Friendship as Mr. V. I was born and raised right here in Washington, D.C., and actually went to high school in the Northeast Quadrant. I have been working in mental health since 2013 and working in my hometown of D.C. since 2015. I currently work at FPCS Blow Pierce as the school social worker.
Good evening. Hi, I'm Mrs. Jeanette Davis. I was born in Queens, New York. I grew up in Philadelphia, Pennsylvania. I attended Philadelphia, Pennsylvania City Public Schools. I worked with students in Maryland Public School System for 15 years before I went over into Washington, D.C., the district. Now I'm currently working for Friendship Public Charter Schools, Blow Pierce Academy, as a professional school counselor and have been since 2019. Okay, so let's get started. So now let's talk about the elephant in the room. The past year has been absolutely stunk. We've all been going through difficult times. Our scholars, our parents, our staff, our friends, our family. The list is long. These have been hard times for everyone. And if you're really feeling overwhelmed, you are not alone. So let's get started. What are some ways that we can cope with stress? So, number one, we could use physical fitness. Two, some mindfulness, breathing exercises, eating well, taking care of our health. Good health can help with good mental health and vice versa. Talking about how we are feeling with people that we trust. Self-care is very important. Exploring creative outlets like drawing, painting, making music, or listening to music. Taking care of our spiritual needs. Can you think of any others?
I can, Miss Davis. Cooking is one of my favorite ways to engage in self-care. After a long day, just coming home to the kitchen, spending a couple hours cooking a nice meal for my fiance and I always makes me feel good.
Yes, and eating well is pretty much like a real biggie as far as helping cope with stress because a lot of foods that we might eat that's not good for us will enhance stress, or we might stress to have certain foods. So, very good. So, what to do when we are struggling to cope on our own? If you or your kids need a little bit of extra help, that's okay. You're more likely to get help if you're willing to ask for it, and taking care of things before they get out of hand can prevent bigger problems later. We want to do our best to be, well, preventive, taking care of something to prevent it from becoming a bigger problem later, versus reactionary, taking care of something after it becomes an urgent problem. Like being preventive, like, if you're not feeling well, we're not going to just you don't want to sit around and say, oh, it's going to be okay in another day or two, because it could become a problem. That's what a common cold. It could turn into something more serious. So being reactive is like taking care of something after it becomes an urgent problem. And a lot of times that's what we do. We'll wait, and then the next thing you know, it's something worse than what it should have been. So we will now provide some examples. Can you think of any others?
I think a good and relevant one right now is the COVID-19 vaccine. Getting the vaccine before we go back to being normal will prevent us from getting COVID later on.
Yes, exactly. Okay. All right. What to do when we are struggling to cope on our own? How can we work on being more preventative? Well, practice good coping skills like the ones we listed. Participate in mental health workshops. You're doing this right now. Know the signs and symptoms that someone is unwell mentally. What might this look like? Hmm. Sleeping too much or too little, a loss of appetite, feeling stressed all the time, having consistent bad dreams, feeling persistently sad or angry, hearing or seeing things that aren't there, a lack of hope about the future, a loss of interest in things we usually enjoy, and many others. Yes, overeating is one. Exactly, Miss Ryder. Overeating is really a biggie, because when we're stressed and when we're under pressure, that's what we'll go to, our happy place, food, overeating. If you notice any of these things happening with yourself, your kid, a friend, or a family member, it's important that you try to find some support. That being said, as a member of the friendship family, we have done our best to make this as easy for you as it can be. You have access to many health resources within your school building as well as within the virtual setting. Even if you aren't planning on returning to the building, our clinicians are still working their normal hours.
All right, thank you, Miss Davis. I will step in now. Part 3, we're going to talk to you a little bit about the help that is available right here at Friendship. Help is right around the corner. At our schools, we have a variety of mental health professionals who can assist you in-house, including school social workers, DBH, or the Department of Behavioral Health, clinicians, smile therapists, psychologists, and school counselors. And we just wanted to take a moment to remind you all that while quarantine can feel very isolating, it's important to try to remember that help is still as accessible as it was when we were out and about. Any of the folks we listed are trained in how to help you and are more than happy to assist. Also, having a conversation with one of our mental health professionals, such as myself or Ms. Davis, doesn't necessarily have to be serious. We are happy to help with minor inconveniences as well, and talking to one of us doesn't mean we're going to recommend you go straight to medication or straight to therapy or anything like that right away. So here is a list of things that we would be more than happy to assist you with. We can help you process and assess any mental health symptoms you might be experiencing. So if you notice some of those things that we talked about a couple slides ago are happening, like a loss or increase in appetite, not being able to sleep well, feeling constantly worried or overwhelmed, we can help you figure out what might be going on. We can also help you process grief or loss. We can assist you in finding resources that you might need. And this doesn't necessarily just refer to mental health resources. We do a little bit of everything. We can provide you with education on items related to mental health. assist you with crises, such as someone having self-harm ideation. We can provide short or long-term counseling services, whether you or your kid just need maybe 2 or 3 sessions or 50 sessions. It's all good, and we are very flexible. We can refer you to outside organizations that can provide mental health services, such as counseling, community support, or medication management. And we can perform check-ins with you and your scholar. If you've just been feeling some type of way lately and you want someone to have a little conversation with you or your student every so often just to make sure everything's good, we are more than happy to do that. And I think I do that for about 20 different kids and families in my building. So we are very much used to it, much enjoy it. There's also something important to remember when it comes to reaching out to us, and that is there is no such thing as a dumb question. Even if it seems slightly mental health related, like, maybe this is mental healthy, maybe it's not, that's just fine. Feel free to come and pick our brains. Our school social workers and counselors in particular have a wealth of knowledge about resources in the District of Columbia. And like I said, this goes beyond mental health as well. We have information on food resources, housing resources, really just about anything you can think of. If it's in DC and you need it, talk to one of us and we can try to help you track it down. And for part 4, I just wanted to take a couple minutes to work on breaking down some of the stigma surrounding mental health treatment. There are a lot of myths about what it is, so we think we'd like to give you all a little bit of an idea of what it can look like. Mental health treatment is handled by highly educated people. All therapists, and of course your school social workers and psychologists, have a minimum of a master's degree and need to pass board exams and multiple background checks before they are licensed to provide treatment. And I tell you what, those board exams are a headache, but we get through them. All medications are prescribed by doctors, nurse practitioners, or physician's assistants who are also board certified and have passed multiple background checks. Mental health treatment is also varied. Treatment plans, or what's necessary, are individualized and written for specific people. They can include a variety of services other than just therapy or medication management, such as community support, case management, and CBI, community behavioral intervention, or some of the things we discussed previously, like check-ins. Mental health treatment is also affordable. If you are a Medicaid client, all services will be provided at no cost to you. If you have private insurance, they might include copays, but the Affordable Care Act, or Obamacare, mandated that all private insurers cover mental health treatment. Mental health treatment is also confidential. If you talk to one of us, we are not allowed to share the information that you or your scholar tells us, unless it involves abuse or neglect, or the person that we are helping is a clear and present danger to themselves or others. Basically, a mental health worker can't just go and talk about your business. And now I wanted to take a little bit of time to talk to you all about what mental health treatment is not. It's not CPS or removing your kids. While clinicians are mandated reporters who are required to report abuse or neglect, we are primarily there to help whoever needs assistance. Just because someone like me's job title is social worker, it doesn't mean we're talking to you or your kids because there are any suspicions of anything being wrong in the household. Mental health treatment is not always medication either. While you can choose to consider medication as an option, you can also choose not to. For outpatient services, it is extremely rare for medication to be required, and this generally only happens in the most extreme cases. If you have personal or religious reasons not to want medication, they will almost always be respected. Mental health treatment is also not a sign that there's something wrong with you as a parent or with your child. Mental health problems absolutely everyone across all races, ethnicities, and socioeconomic backgrounds. Mental illness is just like any other illness, such as the flu. Sometimes, like your body does, your brain and nervous system become ill and you need to be treated, just like the flu would be, or a common cold would be, or something like that. Mental health treatment is also not necessarily hospitalization. Generally, only the most acute mental health problems require hospitalization, and hospitalization only occurs if the individual is a clear and present danger to themselves or to others. Mental health clinicians are actually very diverse and come from a range of cultural and socioeconomic backgrounds themselves. While people often perceive mental health as being a snobby and academic field, that isn't actually the case. Particularly right here in DC, there's a good chance that you can find mental health professionals who you feel like you can relate to. So you might think mental health treatment looks like this, right? You're laying back on your couch, the therapist is making you look at ink blots or something and asking how it makes you feel and yada yada. But however, mental health treatment can actually look more like this: going outside, throwing a football and having a conversation with your kid, or coming to your house and having a conversation with you right at home. Mental health treatment has developed a lot over the years, and it's become a lot more unique and a lot more varied. I meet with my kids once a week, and oftentimes we'll go weeks on end without even setting foot in my office. Part 5, additional resources. While the professionals on your campus are a great place to start, we have other options as well. DC Medicaid plan holders can call the Access Helpline at 1-888-793-4357. I've said that phone number quite a few times to get linked to mental health services. Sometimes there is a significant waiting period between the call and starting services, though, so it's a good idea to speak with your campus social worker about interim supports while you wait. If you get linked to someone, but they're like, no one's going to be in touch with you for a couple of weeks, you're more than welcome to give one of your campus social workers a call, and we can kind of do some short-term counseling or really whatever is necessary, so you don't have to wait to get those services if help is really needed pretty quickly. Private insurance plan holders such as Care First, Cigna, Aetna, United can call the mental health number on the back of their card or search for providers on Psychology Today's website, which has a tool that allows you to search for providers that are in your network of care. However, sometimes situations require an immediate response. We call a situation like this a crisis. Here are some examples. If you, your child, or someone you know says that they want to harm themselves. If you, your child, or someone you know is seeing or hearing things that aren't there. If you, your child, or someone you know says they want to harm someone else, or if you, your child, or someone you know is in immediate danger of being harmed. If a crisis occurs during school hours, the school social worker is available to help. Give us a call. We will walk you through whatever has to happen. But just in case that crisis occurs outside of school hours, we just wanted to let you all know that there are still supports that are available to help you. If you're an immediate risk to yourself or others, you should use emergency services by calling 911. And for mental health related situations, you can actually request a CIO, or Crisis Intervention Officer. There's a program that trains them through the DC Department of Behavioral Health to make them more capable and adept at responding to mental health emergencies. For people between the ages of 6 and 18, AKA almost all of our scholars, if they're experiencing a mental health crisis, the CHAMPS team is available 24/7 and can be reached at 202-481-1440. They will send a crisis team to assess and stabilize any mental health crises completely free of charge. And I worked over there for a couple years. They're good people. They'll definitely take care of you. If you feel as though you can reach the hospital safely, Children's Hospital on Michigan Avenue offers emergency psychiatric treatment for people under the age of 18, and Washington Hospital Center, which is literally right next door, offers the same services for adults. And CPEP, or Comprehensive Psychiatric Emergency Program, it's a mouthful, you can just call it CPEP, offers emergency crisis intervention for individuals over the age of 18. They can either send a team to do an evaluation or evaluate someone at their offices located at 1905 East Street Southeast, which is on DC General's campus. You can also reach them at 202-673-9319. If you're interested in medication, you can speak with your primary care provider. Many primary care providers are capable of prescribing medications for conditions like anxiety and depression, and can also help refer you to outside resources if needed. There are also myriad support and self-help groups available in DC for a variety of different reasons, although I wouldn't recommend subbing them for mental health treatment if it's mental health treatment that's needed. All right. So part 6, we're just going to give you a little bit of a summary to tie everything together. The past year has been miserable. And if you're feeling stressed or overwhelmed right now, it's totally okay. I always say it's okay to not be okay. I think a lot of us are feeling that way these days. Some ways that we can cope with feeling stressed include exercising, maintaining a healthy diet, talking to trusted friends or family members about our difficulties, practicing mindfulness, and of course, practicing self-care. But sometimes our usual skills might not be enough. If that's the case, or we are experiencing significant mental health symptoms such as loss of appetite, difficulty sleeping or sleeping too much, feeling overwhelmingly scared or worried, feeling sad, feeling hopeless, feeling angry, things like that, it might be time to ask for a little bit of extra help. I did want to remind everyone that if mental health treatment is needed, it's important that you seek it from a professional. While someone like your friend, spouse, family member, pastor, support group, or other positive person in your life might be an excellent support, if someone is experiencing significant mental health symptoms, it's important that they speak to someone who is trained in how to address and treat them. But fortunately for us as the Friendship family, help is available in our schools. On our campuses, we have social workers, school psychologists, smile therapists, DBH clinicians, and school counselors. If you need some extra support for your child, yourself, or a family member, speaking with a professional in your school is a great place to start. We can provide support services directly or assist you in tracking them down if you are looking for something outside of the school building. And just because we are in a virtual setting right now, that does not mean we aren't working. All of the mental health professionals are working their normal hours. And if you need some assistance, you can track us down. And we can even meet with you or your kid virtually, like we're meeting right now. If you'd rather seek support outside the school building, that's okay as well. Medicaid plan holders can seek mental health services through the Access Helpline, and people who have private insurance can utilize Psychology Today or contact their insurance provider. If you encounter a situation that requires an immediate response and isn't during school hours, you can call 911 and ask for a CIO officer. If it is safe, take the person who is experiencing a mental health crisis to the hospital or call an ambulance to do so. And you can call the CHAMPS line for assistance with someone between the ages of 6 and 18, like most of our scholars are, or call CPEP for assistance with an adult. The moral of the story is that support is always available if you know where to look. You've got a lot of people that are available through Friendship that are here to help you, and help is never far away. Just pick up the phone and we will be there for you. All right, we decided we would like to open up the floor to a little bit of discussion now.
Thank you. I always love your presentations. A question about when you start to recognize abnormal signs that you may need to go a step further and seek additional help. What is, or is there a recommended time frame for abnormal? Like, is it a day? Is it 3 to 5 days you may be experiencing the same symptoms? What would you recommend?
What I would say is that it's pretty varied. Unfortunately, mental health symptoms can be kind of unpredictable, and sometimes serious stuff can pop up overnight, or sometimes it can take years. My recommendation is, when in doubt, reach out. Like I said in our slide, there's no such thing as a dumb question. If you think something might be up in regards to someone's mental health, give one of us a call. We're more than happy to talk to you.
Yeah, and I'd like to add to that, because in some cases, parents feel a little reluctant not to reach out, but they can always reach one of us, and we'll pass it on, to make sure that, if I hear anything, if I get any information about a student or scholars, going through a little something, I usually pass it on to the therapist, someone that I know can immediately provide that support. So it just varies.
And
Just want to make sure parents are aware. There's no time limit.
yeah, and as Ms. Davis is very familiar with this, I feel like I've said this in a lot of our meetings with teachers and families and leadership. I would rather help with 10 things that wind up being nothing than miss the one thing that's something. And I think just about anyone who has a mental health license would agree. So, don't hesitate. Even if you're not so sure, we'll talk to you. We'll help you figure out what's going on.
So, you talking and helping us figure out as a parent, is there a fee associated with that initial conversation? If a parent doesn't have Medicaid and they have private insurance, or is it, how is there a cost associated with like the consultation or just the chat?
There's no cost at all for seeing any of the friendship clinicians.
No cost at all.
No
I think that's another thing, right? Like you
Yeah.
think about dollar signs and you think about, oh, I don't want to have to put up any money, even if it is a copay.
Yeah.
Some people, they think about that, and that can be a barrier to reaching out and asking for help. Another question that I had was, if I am a parent at one of our friendship schools and I don't necessarily feel comfortable going to our student support team at the school that my child goes to, can I go to another campus and reach out to a student support team that I may feel more comfortable going to?
In my experience, once in the friendship family, always in the friendship family. We've communicated. I have helped families of students that have graduated and gone on to other friendship campuses. Really, if you ask any mental health professional who's under our umbrella, for help there, they'll help you. They're not going to be like, no, well, why don't you just go through this channel or whatnot.
Mhm.
That's good to know, because I mean, you two are doing the presentation, and it may be a parent at Armstrong who may want to go to you, Mr. V, and you're at Blow Pierce. I remember Mr. V. I want Mr. V. I want Miss Davis because she did that mindfulness session for me, and I like her. And so we have our preferences, and so just wanted to see if a parent who doesn't attend a certain campus, can they reach outside of their network? Those are all the questions that I have. I'm looking on our Facebook and our Zoom chat, and they're not questions, but someone just said thank you for sharing. That was Ms. Campbell. She said thank you for sharing, and thank you for always being available for our parents. Thank you for sharing this helpful information. Parents, I hope that you found this helpful. I hope that you will use this information. Please don't hesitate to reach out to us. We are here. We shared our contact information, and the hotline. I'm still going to share it again. 202-281-1777, or you can email us at wecare@friendshipschools.org. I hope that you will join us again next Tuesday. We'll be right here at 4 p.m. Eastern Standard Time every Tuesday. Be sure to follow us on our social media page, Friendship Public Charter School. Make sure that you sign up so that you can get the notifications when we go live and when we have events, because we have a lot of things happening that you don't want to miss. Also, be sure to follow us and subscribe to our YouTube channel. It's Friendship Public Charter School on all platforms. So definitely look for us, follow us, and we will see you next Tuesday at 4 p.m. Have a great evening.
Thank you all for being here.
Thank you.